We are continuing this upper extremity dissections and the practical lecture classes. We have seen some of the content and the structures which is present in the upper limb, in the axillary region, arm, forearm, etc., etc. So we are just like going to the theoretical detail of the content of the structures. That is, we have dissected and seen, and we are going to talk about the clinical anatomy, which is relevant and related to this structure as well in this axilla and axillary structures over here. Now in axilla, we have few number of content and soft tissue element is there. In axilla, we have a space which is occupied or traversed by neurovascular structure. That means we have some nerves, we have some artery and the veins and vessels which are present and running through it and traversing. Many of them are branching out and many of them are making some network or complex structures which we are familiar with. We are just like going to jot it down what this particular axilla means and the structures over here, the boundaries, which is kind of like familiar with us. It has a like inverted pyramid shaped structures or kind of truncated pyramid, I would say. Upper part is cut open. It has some walls and the boundaries, and it has an apex and the base, which is formed by some of the base is formed by the skin over here by the axillary fold, and the apex is directed towards this particular clavicle or the collarbone. Now it has walls, 4 of them. We are considering this anterior wall, posterior wall, lateral wall and the medial wall. Medial wall is placed over here in this thoracic or chest wall, and opposite to the medial wall will be the lateral wall, which is formed by the arm or these muscles in the arm. Now this anterior wall, which is formed by the anterior chest wall, which is present in here. That means we have this pectoralis major, pectoralis minor, which is present on this side. They are forming. The back side, which is forming the posterior side, which is formed by this muscle attached to the scapula on the back side, latissimus dorsi, subscapularis, all these muscles. So these are the 4 boundaries or 4 limits of this particular axilla, apex, base and the walls, which are formed by this particular thing. Now through this particular content on the structures, we have a number of soft tissue structure which is packed over here by the fatty tissues. So whenever you are doing the dissections, we encounter tons of fat in this region. We clean this particular fats, then we come across this particular content or neurovascular structures which are present in here. Now it is easy to figure out what are the neurovascular structures that are present in the axilla. They go by the name of axilla. If you see any artery, we call them as axillary artery. If you see any kind of vein, we call them as axillary vein. If you see some kind of bunch of nerves which are coming in this region, we call them as axillary nerve. Now this particular axillary nerve is a kind of like a togetherness which we are going to see, or axillary nerve plexus. And axillary nerve plexus we mean here with a special name, we call them as brachial plexus, which is point of concern to us. But before that, we just like to quickly run to these particular walls, as you have mentioned, the pec major, minor, subclavius, the anteriorly, which is covering this, maintaining these borders of this axilla. So if you see this particular picture, which is schematic one, this is the back side heading this particular vertebra. This is the spine of vertebra which you can feel, and the back side, this part is spine, and this is the vertebral body. Now this is a sternum, which is front side. So you can figure out this is posterior side, this is anterior side, and this is, if it is posterior anterior, this is midline will be close to here. We can see the cut sections of the rib in a circular fashion, which is present in here. So these are the ribs which are present in here, and this side is the humerus. So this is the lateral side, this is the medial side. Now this encloses over this triangular shaped space which we are in dealing with. The anteriorly we have this pec major, pec minor, and posteriorly we have this particular blade of the shoulder which is formed by the scapula, and the muscles subscapularis which is present, and even beyond we have this lat muscle coming on the back side, which we have appreciated before. On the medial side, we have a muscle, we call them as the intercostal muscles, which is between these ribs, and top of the ribs we have a muscle, we call them as serratus anterior. So this particular deep muscle which is present deep in axilla, we call them as serratus anterior, making this particular medial side. And the lateral side we have the humerus, which is present on this region. Along with the humerus we have this particular muscle attached to the humerus, making this particular lateral boundary, which you have dissected yesterday, like biceps, thoracobrachialis, and the brachialis, etc., etc. So these are the forming of this particular muscular boundaries, and many of them we are encountering these particular ribs and etc., etc. So this is the contained on, or this is the boundary over there in this axillary region. So this is what we are dealing with. Now, whenever you are going to talk about what lives in this particular space, we have to encounter two structures. We call them as neurovascular bundle. One is that like nerve plexus that we are going to talk today, brachial plexus, axillary nerve plexus, and then we have the vein, axillary vein, and red one is an artery. We call them as axillary artery. So we just like briefly run through this particular content as the axillary artery first time. It is a continuation of some artery going to the axilla and breaking down into this arm and even to the forearm and making smaller branches. Yesterday we also have dissected out branches of these things like radial artery, ulnar artery in the forearm region. So this artery comes from the artery, we call them a subclavian artery. Subclavian artery which comes from this particular branch of aorta, from a particular branch which is coming on this region and arching like this on the top of rib 1 and entering to this particular below the collarbone region. Once it reaches below the collarbone region, it is then changes with the name after it crosses the rib 1. It changes the name from the subclavian artery to this axillary artery. So it enters to this particular axilla once it crosses the rib 1 and enters to the domain. Now once it enters to the domain, it is theoretically or for purpose of understanding, it is divided into three parts by this particular muscle attachment. We call them as pectoralis minor. So this pectoralis minor lies deep to the pec major. So if big muscle on the chest, we have pectoralis major. If you cut this under to it, we find this particular muscle, we call them as pectoralis minor. So this pectoralis minor is overshadowing on this particular sub-axillary artery which is present in here and splitting this particular axillary artery into three segments for our descriptive purpose. Before this particular attachment or covering of this pec minor, which is zone 1 or part 1, part which is covered by this pectoralis minor, we call them as part 2 of the axillary artery, and then we have this particular artery part which is beyond that, we call them as part 3 of this axillary artery. So part 1, part 2 and part 3. So this entire length from the rib 1 till it crosses this particular teres major muscle at the bottom end between here the rib 1 to this particular here, this particular teres minor, we call them as axillary artery because it is coursing through the axilla. And after that this axillary artery becomes the brachial artery, becomes a brachial artery. That brachial artery reaches to this particular forearm space, to this particular arm region, and in the arm region we call them as brachial artery, and once it reaches to the space we call them as cubital fossa. This particular artery splits down into two branches, we call them as axillary artery, we call them as radial artery and ulnar artery. Each of these particular branches sends down few of the arterial branches like this one. Part 1 usually gives one branch, we call them as these branches we call them as internal thoracic artery which is coming from the part 1. Part 2 sends two branches which is going down, we call them as lateral thoracic artery, and this one we call them as thoracoacromial trunk which is sprouting into three branches which clumps through this particular clavipectoral fascia. The third branch gives branches which is part 3 which you are seeing here is coming branches over here, three of them. One of them is going down, we call them as subscapular artery, and then we have two branches circumflex or encircling around this particular humerus, we call them as circumflex humeral artery, anterior and posterior. So these branches which is coming from the axillary artery, they are like the branches which you have to partly understand and partly know this particular. Probably you can memorize these branches. First part brings what branches, second part comes with the two branches, third part comes with the three branches. So each of these particular branches, if you can memorize, you can memorize. If you cannot, just let go. Just know that it has some branches which is going down into three different segments. Now from this part of this particular artery, which I am just like not talking a little like much detail about it. So we are moving to this particular region, which is this point of concern for us is the axilla or axillary region. Is this one, we call them as brachial plexus. So these nerves which are present in this region makes a kind of like a networks or interconnecting channels. They are joining or making some kind of like a union, and then they are breaking into forming some other branches. So this network which is present in axillary region, we call them as network of the nerve plexus, we call them as brachial plexus. Brachial means arm, which is related to it. It supplies all the muscles which are present on the arm, and their exchange of this nerve fiber which is happening in this particular axillary region, which is probably we have dissected and seen these particular branches in our dissection classes. So this is the class which we are talking about. Now see, this particular nerves come from the spinal cord, and spinal cord segment, we divide the spinal cord into segments based on how the spinal cord is located. So if it is present in this neck region, the spinal cord segment, we call them a cervical region. That particular spinal cord, when it drops down to thoracic region, we call them a thoracic spinal cord, and lumbar and coccygeal, etc., etc. So this particular nerves which is coming from this particular neck region, we call them as cervical spinal nerves, and part of this particular thoracic, one of them are contributing to form this particular nerve plexus. So we number this particular nerve based on the counting from above. Like if it is coming from 1 from the cervical region, we call them as C1. If it is coming from the cervical 2, we call them as C2. If it is the spinal nerve which is coming from this thoracic segment, we call them as T1 or dorsal 1, like that. T1, T2, T2, T3, like that. So we number this particular spinal cord based on where from and how high the particular spinal cord nerve is coming on. So segment wise, this particular spinal nerves are named. So this brachial plexus formed by the nerves which is coming from the cervical nerve or cervical regions of this particular spinal nerve. So we have 7 cervical nerves present in this particular region. We call them a C1 to C7. So C1 to C7, not all the nerves form this plexus. Couple of the nerves which forms this particular nerve plexus forming, and couple of the nerves do not form any plexuses. They just like supply the muscle individually. So we have to know which cervical nerve forms this particular cervical nerve plexus or forms this brachial plexus, and this particular brachial plexus, how this particular things forms and breaks and forms the sub branches, which is point of concern. So we often see this particular brachial plexus formation and breaking down, and the distributions of these particular nerves as formations of this particular nerve, as how it is formed and how this particular thing breaks down into this particular smaller branches, and what does it supply. That is a maybe given a long term questions, which is like a long question, like 14-15 marks long time question, we get it. So they ask the whole thing what we are going to talk about. Now you see that the subspinal nerve which is coming from this particular region over here, we call them a cervical spinal nerve, and this particular cervical spinal nerve, it starts to form here, we form the segment, we call them a C5. So the C5, that means the 5th cervical spinal nerve, first one to contribute or participate to the formation of the brachial plexus. So we see that in sequence C5, C6, C7, C8 and T1, that particular 8 segment nerves which is coming in this region and forming this particular brachial plexus nerves which is present in here. So this particular brachial plexus begin from this particular anterior rami of the C5, C6, C7, C8 and T1. So I want to correct this particular C8 is that nerve. I mentioned that C7, that is only 7 cervical nerve is present. It is only 7 cervical vertebra that we have. The cervical nerve we have in this region on the neck region is 8. So 1, 2, 3, 4, 5, 6, 7, 8 pairs of spinal nerve present, and only 7 cervical vertebrae are present. Sorry, I got mixed up between this. So we have this anterior rami of this particular brachial plexus which is forming here. Okay, so this particular spinal nerves which are coming from this particular region coming together and making this particular plexus. Now the whole of the spinal nerve, we know that this has got like a rami which is coming from this particular roots of common spinal nerve. So this particular spinal nerve have got 2 roots, anterior root, posterior root, which makes this particular common spinal nerve, and again it divides into anterior rami and posterior rami. The anterior rami we are referring here is coming to the anterior side and uniting to form this particular plexus. So we talked about this particular rami and the divisions whenever you are putting the introductory class of the spinal nerve and the spinal cord segment we are talking before. So this particular complex of the spinal nerve which is contributed by this particular C5, C6, C7, C8 and T1, They are coming and forming a network or plexus, and then they are undividing and forming some sub further plexus. So this is what we are talking about. This particular spinal nerve have got roots, as you are seeing here. We have this particular ventral root and the dorsal root uniting together, making this particular common spinal nerve. Now after this common spinal nerve again splits into two branches. This is known as ventral rami, this is known as dorsal rami. The dorsal one goes on the back side, the ventral one comes to the front side. This ventral rami of the C5, C6, C7, C8 and T1, they makes this particular union and forms this plexus. So this ventral rami, as you can see, coming down to this particular region, C5, C6, C7, C8 and T1. T1 means the thoracic one spinal nerve, that form union at this particular upper part of the neck region, and then they just like breaks down into smaller branches, and then they again unite and enters to this particular axillary region. So they start forming over this particular region and enter to the axilla and form the branches of the nerve and then eventually go. Now this is how they are forming over here. Now when you are doing the dissection, we cannot do dissections in the neck region because we are doing the dissection in the arm region. So we see this particular spinal like this brachial plexus beyond this V1 once it enters to the axilla. That is already formed some of the branches or this particular complex network we can see. So we see this particular thing like this one is the schematic one, that what we see that. We see that the C5, C6, C7, C8 and T1, they unite together with this C5 and C7, these two unite, forms this particular union point. This first union point which is formed over here, we call them as trunks of brachial plexus. So this C5, C1 unite and C8 and T1, this particular ventral rami unite and forms two trunks over here. We call this as upper trunk and lower trunk. Now you notice that this particular middle one or C7 spinal ventral rami do not form or unite with anyone. They go by all itself. It forms another trunk, we call them as middle trunk. So all these ventral rami from the C5, C6, C7, C8 and T1, they just like some of them unite together to give rise to this particular trunks. We call them as upper trunk, middle trunk, lower trunk. Now this upper trunk, middle trunk, lower trunk, this formation takes place in the neck region which we do not see. Now what happens after that? These trunks, upper, middle and lower, splits each of them into two sub branches. We call them as anterior division and posterior division. Anterior and posterior, anterior and posterior. So two of the subdivisions are coming from each of these particular trunks. Upper trunk, middle trunk, lower. That means 3 into 2, 6 divisions we are taking. Now these divisions which is taking over here, which is seeing here, we call them as anterior division and posterior divisions. Now what happens with here, all the posterior divisions which are coming from these trunks, posterior divisions of the trunks, one, upper one, middle one and lower one, they unite. They unite to give rise to a common trunk, we call them as posterior cords. So we have initially roots, then that is united to form this particular trunk, and then it divides into anterior and posterior. All the posterior unite together, gives another thing, we call them as cords now. We call these cords as posterior cord, which are united by these posterior divisions. Now you see that this upper one splits into anterior division and middle one has anterior division which unites eventually, forms another cord. We call this cord as lateral cord. And then we are left with only with this particular lower trunk anterior division which forms this another cord which is known as medial cord. So eventually, so there was 6, 1, 2, 3, 4, 5, then uniting into 3, 1, 2, 3, then it is splitting into 6 over here from the division. 6 division again unite to form this particular 3 again. So we get this particular roots to these trunks and the divisions, and then we have this particular cords. We have 3 cords, lateral cord, posterior cord, middle cord. So this particular medial cord. So this particular cords up to this much is present below this clavicle. So we cannot see this particular cords formation till that part is invisible to us as we are not doing the neck dissection. When you are going to do the neck dissection, this much will be visible. So what we are seeing here is beyond this cord is that this particular cord splits down into smaller branches. those branches are present in the axilla. That's what we are seeing. So this particular cords, these main cords like lateral cord, posterior cord, medial cord, each of them breaks down into smaller branches. Those branches are visible to us, which we are doing the dissection in the axilla, arm, forearm, we are going to see. Now, what's part of this particular class is that we have to draw this, all of them, we have to draw these particular divisions, we have to make these particular trunks, cords and the branches from it, the nerves which are coming from here of this particular cords and roots, everything we have to draw it and we have to just like memorize it. So here we are seeing here what I am referring here. This much we cannot see because this is above the clavicle. This much is formed over here, and once this particular cords are formed, it splits down into the branches. Those branches are visible to us, like radial nerve or median nerve, etc., etc. Those are visible to us, which you are seeing here. But the entire thing is not visible to us yet, as we are not seeing them, but they are present in the higher level, deep into the neck muscles. So this is what we are talking about. So each of these particular roots splits down into smaller nerves. That's what you have to know, that's what you have to identify and do it. So what we are doing right now, in next 5-10 minutes, we are going to draw this particular brachial plexus, all of us at the same point of time. I will show you how to draw this and how to identify these particular nerves and how to figure these particular nerves, what they are actually doing. So we have to take out like pens and the pencils or the whatever the things we have, drawing instruments. If you have different colors, that will be good for you to just like mark it differently, so we then cannot mix them, because this is going to be our long exam question. This is what we have to draw, a schematic drawing of this brachial plexus, of these complex networks of this nerve. So we start with this particular brachial plexus formation and drawing of this. So initially we have 5 spinal nerve ventral rami with us, C5, C6, C7, C8 and T1. So these are the 5 branches of the spinal nerve ventral rami. We understand what do you mean by the ventral rami with us, then we are done. Now what we are going to do, this particular thing, we are going to draw the brachial plexus and the nerves and the branches of the nerves which are coming through it. Now C5 and C6, we have seen they are uniting and making a common thing, and the lower one C8 and T1, again they unite to form another thing, and C7 is ununited, remains there. Now we call them as trunk, right? So initially from this particular 5 we are getting 3 trunks. We call them as upper trunk, middle trunk and lower trunk. Make sense? So from this union of this C5, C6 uniting and the bottom 2 are uniting to give rise a common trunks from this particular roots. Now once we get this particular trunks, then again we have to split this. 3 of them makes 6. That means this each of these 3 becomes 6 by splitting into branches. We call them as divisions. There are 2 divisions are there. We call them as anterior division and posterior division. So you use 2 different colors to identify 2 divisions. So this one is A and the violet or the purple one is the P or posterior divisions. Now we unite this posterior, all 3 of them together. So we get a single thing from 3 of them. So we get this particular posterior one, we call them as posterior cord. Okay, so all the posterior one uniting together, we get this posterior cord. Now what we are going to do is that the upper and the middle, the anterior divisions, both of these unite together to make a chord. We call them as lateral chord, L chord. Okay, and then we are left with the ununited division of these anterior divisions of the lower root, which goes as medial chord. So this complex drawing of this brachial plexus we have figured out. So first we have 5, then we have 3, then we have 6, and then again we are joining into them into 3. But this particular thing of making this particular plexus, of the formations of the plexus, is not the way it is actually is uniforming. C5, C6 unite, the bottom 2 unites, then forms this particular thing, trunk. Then trunk divisions happens. We call them as anterior divisions and the posterior divisions. Posterior one goes together, forms this particular chord. We call them as posterior chord, and posterior chord is going along. Now, then we have this particular lateral chord formed by these anterior divisions of the upper chord united with the anterior divisions of the middle chord. Then we get this lateral chord, and this ununited or left over these particular anterior divisions of the lower chord, lower trunk, goes as medial chord, which goes and runs here. So this much is clear to us or not? Okay. So what I am going to do here, we are going to erase this. Now you flip your page where you have made the drawing, and before that make a good look at it. Okay, so you have a good look at it, whatever the drawing you made, then you flip the page, get you a fresh page, and again without looking at, draw the thing whatever you have done so far. I am drawing this as well, so if you can beat me while drawing it, you raise your hand. Okay, good. C5, C6, C7, C8, T1. Upper 2 unites, lower 2 unites, middle one do not, and again splits, 2 divisions, anterior division, posterior division. All the posterior one goes through the posterior chord, and this one and this one makes this lateral chord, and this one goes on medial chord. So see that I beat you. I'm 50 years old, but still I'm beating you. So you guys have to beat me with your speed. Now come on, again. I give you another chance. So what you have to do, even when I wake you up in the middle of night to ask you to draw the brachial plexus, you will say, oh, Dr. Chaudhary, this is it. Now let me sleep. So this has to be on your spinal level whenever you are practicing this. So that has to be that smooth. So once again, you are ready? Who is going to beat me? Name me. Who is going to beat me with drawing these basic drawing of this brachial plexus? Ready or not? You are going to beat me. Yeah, go ahead. Chalo, shuru. C5, C6, C7, C8, T1. C5, C6 unites, C7 goes along, C8, T1 unites, makes this particular upper chord, upper trunk, middle trunk, lower trunk. Then we have 2 divisions, anterior, posterior, anterior, posterior, anterior, posterior. All the posterior one goes together. We call this posterior chord. This one and this one goes on this lateral side, lateral chord goes along. This one is the medial chord. So we take a 10-minute break. Alright, so when I come back after the break, you can also take a break. You are going to draw faster than what I am doing, every one of you, one or two, because this is the only beginning, because we have to draw and elaborate and everything. So on this page, I want whole of this upper extremity fitted. So is one page, everything, whatever you are studying will be can be accommodated. This simple drawing, I'll show you how. Once you do this, you can learn all the muscles, all the muscle actions of upper extremity, everything in. Trust me. So today we are going to do these 2 hours. You are going to learn all of our upper extremity muscles in detail. C5, C6, C7, C8, T1. What happens to them? We call them as rami. Then these two unites, makes these trunks. So upper trunk, middle trunk, lower trunk. Each of these splits into 2 branches. Anterior division, posterior division. The posterior, all 3 unite, makes this cord. We call them as posterior cord. Now this upper 2 unite of this anterior one, that makes this lateral cord. And then we are left with one only, which is only ununited, makes this medial cord. So 3 of these particular element is coming from these particular aspects. So upper, lower and middle 3 divisions is coming from here. Now we are going to do further branches and sub branches which are coming from each of these particular cords, how they are coming and how they are going on. So altogether, when we end up, we will be going to draw nearly 17 to 18 nerves. Now once we know these particular nerves, we are going to talk about the muscles who are going to be supplied by them. Once we go by these particular names of the muscle, we are going to talk about the actions of the muscles and subsequently the diseases or loss of muscle actions. So let's do these particular things. This. C5, C6, C7, C8, T1, and each of them are like this. So upper 2 unite to form this particular thing. Trunks, and then we have the divisions, posterior divisions. All the posterior divisions comes together, makes this particular posterior cord. Posterior cord goes along. Then we have this particular lateral cord. So these two are united to form this lateral cord. And this one is going to make this medial cord. Now from these particular roots we have couple of nerves coming, that what we have to going to do. So uniting from this particular rami's of the roots of these particular nerves, C5, C6 and C7, we have a nerve coming down like this. We call this nerve which is going down as long thoracic nerve. So this long thoracic nerve goes down all the way down. We have a nerve coming from this particular C5 here. We call them as DS. Which is known as dorsal scapular nerve. So then we have another nerve which is coming from here and coming up here. So we call them as NS and suprascapular nerve, SSN. So we get 4 nerves from these different aspects of this particular brachial plexus, 2, 3 and 4. So this particular roots and their divisions and the trunks give rise to this many of the nerves, but out of these many nerves we are focusing only on 4 of them: long thoracic nerve, dorsal scapular nerve, nerve to subclavius NS, and SSN suprascapular nerve. These 4 names we have to memorize, which are coming from here. There are plenty of them are there, but we are bypassing them. We are not talking about. We are just talking about the nerves which is coming from these particular roots and the divisions and the trunks, which is related to us in the upper extremity is concerned, or muscle supply to the upper extremity is concerned. Now talk about this particular cords, which is lateral cord, medial cord and posterior cord is about. So from the lateral cord we get usually 3 nerves coming from here. We call them as the main one, continuation as musculocutaneous nerve, MCN, musculocutaneous nerve. It gives a branch which drops down. We call them as lateral root of median nerve. And another branch which comes from here, we call them as lateral pectoral nerve, LPN. So these are the 3 branches that is coming from the lateral cord. The lateral cord, which is the branches of it, we see them. We cord even we cannot address because we mentioned that it's lying deep to this particular under the clavicle. So when we remove the clavicle or do the dissection in the neck, we can see all these particular branches. So 3 branches which is coming from here is present in here. So we number that 5, 6, 7. From this particular medial cord, we have 5 branches present or coming from here. So we have another one to join here. We call them as medial root of median nerve, which eventually gives to formation of MN or median nerve. The main trunk goes here like ulnar nerve, UN, and then we have like lateral pectoral nerve. From the medial root we have a nerve, we call them as medial pectoral nerve. And then comes 2 sensory branches from here. We call them as medial cutaneous nerve of arm and medial cutaneous nerve of forearm. So altogether from this medial cord we are getting 5 or to 6 branches. So we left here with the number 7, then we number 8. Number 8 one is medial pectoral nerve. Medial root of the median nerve is 9. Then median nerve which is coming on here, we name it number 10. The main continuations of the medial trunk, those are the ulnar nerve, we name it number 11. Then we are left with these cutaneous nerves as 12 and 13. So we get 13 nerves together from the lateral cord and the medial cord. Then we are left with this particular posterior cord. So again posterior cord sends down or branches down 5 branches. So this main nerve which is going down makes this particular nerve which is known as rad or radial nerve. Now then we have 3 branches like this. So we call them as upper subscapular nerve. Then we have this one, we call them as lower subscapular nerve, and in between this we have TD, thoracodorsal nerve. So you follow this sequence as I have drawn here: upper subscapular, TD, thoracodorsal, and lower subscapular nerve. So this sequence need to be memorized. এই সিকোয়েন্সেই থাকে, এই সিকোয়েন্সেই মনে রাখতে হবে. It's not like upper subscapular, lower subscapular, thoracodorsal. So you have to remember in this sequence, in this fashion, because they are exiting out like this. because it matters. During surgery, it matters. We'll tell you later on why. So upper subscapular, lower subscapular. In between them, we have thoracodorsal. So the sequence is upper subscapular, thoracodorsal, lower subscapular. And then we have another nerve. We call them as AXN or axillary nerve. So we have left the numbering at 13. So after 13, we get this particular one as 14, 15, 16, 17, 18. So all these branches which you are seeing here, they are coming from these nerves, are visible to us. So this formation, breaking down into divisions, again uniting to form this particular as a trunks and this particular divisions and uniting for this particular cords, this much is not visible to us. Rather, we are seeing this particular nerves or the branches which is present in here. So if you have done this much of drawing, then flip the page once again. So we are going to do this particular again and again. So we have to memorize these 18 branches of them. So see them carefully, flip the page and make sure you number this particular page, number these nerves. Likewise, we are going to draw it. So once again, C5, C6, C7, C8, T1. C5, C6, C7, C8, T1. Now upper 2 unites, lower 2 unites, makes this particular thing trunk. We call them as upper trunk, middle trunk, lower trunk. So UT, MT, LT. The trunks has got branches. We call them as divisions. Posterior division, anterior division. Posterior 3 of them unite together, gives a new nerve. We call them as cord. We call them as posterior cord. Then 2 upper anterior unite once again. So these 2 unite, forms this cord. We call them as lateral cord. It continues. And then the third one, which is ununited, continues as medial cord. Now this much is easy for us. Then we are making this at the complex level. So first we talk about up to here, till this particular cords are formed, the important branches which are present from here. We draw with this particular nerve which is coming from the root. C5, C6 and C7 unite to root, form a nerve which is going down. We call them as long thoracic nerve. In short, we call them as LTN. We call them as long thoracic nerve. Then we have a nerve which goes up. We call them as DS, dorsal scapular nerve. Then from the upper trunk here we have above and down. The down one we call them as nerve to subclavius, and the upper one we call them as SSN, suprascapular nerve. Now we number them 1, 2, 3, 4. 4 of them are coming from this particular point. Good. Then we are moving to the lateral cord. The lateral cord, the main one, continues down as MCN, musculocutaneous nerve. Draw it. Keep drawing. Musculocutaneous nerve. It gives a branch to the pectoralis muscle. We call them as, coming from the lateral cord, we call them as lateral pectoral nerve. Then it gives a branch to form the median nerve. We call them as median root of median nerve. So this is 3 coming from the lateral cord. 1, 2, 3. Number them is 5, 6, 7. So the lateral one is giving 3 branches, 3 of them. Now then we have this medial one. How many of them? Medial one is having 5. 2 of them are sensory and 3 of them are motor. So first to deal with that, this branch which is joining over here is medial root of median nerve, and forming over here together is median nerve. Then we have this particular lateral pectoral nerve. From the medial root we have this medial pectoral nerve. The main trunk of the medial cord goes by as ulnar nerve, UN. And then we have two sensory divisions or sensory nerve. Medial cutaneous nerve to arm, medial cutaneous nerve to forearm. So again we have to do the numbering. So if you have to number it, so you have left with 7. Then we have this branch 8 and median nerve is 9. Then we have 10 medial pectoral, and then we have 11 as ulnar nerve. Then 12 and 13, two sensory divisions. Then we are left with the posterior one. How many branches coming from? 5 of them. So we have one short and then again one. We call them as upper subscapular nerve, thoracodorsal, lower subscapular nerve. So these are the 3 branches. Then we have a branch going down up, AXN, axillary nerve, and the main trunk goes as RAD, radial nerve. So again we are done with the 13. So we have 14, 15, 16, 17 and 18. So we have 18 branches coming from brachial plexus. Okay? Now it's your turn. Get a fresh page, make the final drawing. Every one of you, every single one of you have to make this particular drawing once again. Flawless drawing. You have 2 minutes of time to finish this. Your time starts now. Makes sense. Cheating is a bad thing. Cheating is a bad thing. Number. Count. Show me 18. Number. Anybody have done finished? 3. 18 full count. 18 full count. 18টাই আছে, কোনো নার্ভ কেটে যায়নি। Good. Okay. Any full count? 18 nerves. 18 nerves. Yes. 18 nerves. 18 number করেছো. So you have to do it 100 times. নাম ভুলে যাবে তো, সেজন্যই তো করতে বললাম। কতগুলো হলো? কতগুলো প্র্যাকটিস করেছিস? দুবার, তিনবার, তারপরে হলো না? অন্যমনস্ক নাকি রে? তোর কতগুলো হলো? কেন হলো না? আমরা তো 10-12 বার করে ফেললাম, নামগুলো ফলো করতে পারোনি। কতগুলো হলো? হলো না। কিরে, কতগুলো হলো? 18টা হয়েছে, কাউন্ট করেছো? 18টা হলো, হয়েছে, শুনেছো? So we hardly have 5 of us, 6 of us, 7 of us finished 80 nerves. হ্যাঁ ঠিক আছে, 18টা হয়েছে, 12টা হয়েছে, নার্ভগুলো কাটা পড়ে গেছে। হ্যাঁ হুম, নাম্বার করো। হয়েছে হয়েছে হয়েছে। তোদের কতদূর হলো? বই দেখে দেখে হলো না? বই দেখে হবে না তো, বই তো নেই ওগুলো, যে বই দে, হবে না, লাভ নেই। So once again, last chance, get a fresh page, পরিষ্কার খাতা, পরিষ্কার পাতা। কে কে সব থেকে বেশি কিপটামি করিস পাতা নিয়ে? কার পাতা খুব টান আছে, শর্টেজ আছে, অভাব রয়েছে? আমি ডিপার্টমেন্ট থেকে পাতা দেবো তোদেরকে, কিছু চিন্তা করিস। ফ্রেশ পেজ, এভরি ওয়ান অফ ইউ। মন চাইছে না, মন ভেঙে যাচ্ছে, একটা নতুন পাতা চলে যাবে, শীতের আগেই ঝরে যাবে। ওকে, রেডি? অল সেট? রেডি তো? টাইম স্টার্টস নাও। C5, C6, C7, C8, T1 হয়েছে? এবারে কি হবে? What's going to happen now? Joining. So what are you going to make by joining? Root. How many roots are going to make? কটা রুট হবে? 5টা রুট হবে। 5টা রুট হয়েছে, তারপরে ট্রাঙ্ক করব। We are going to make trunks from these roots. How many trunks we are going to make? 3 after joining these roots. So what we are going to join? Upper 2, 1, lower 2, 2, and the middle one. So we have trunks. Upper trunk, middle trunk, lower trunk. হলো? সবার হয়েছে? Then what is going to happen with these trunks? It's going to, কতগুলো ট্রাঙ্ক হয়েছে? 3টে ট্রাঙ্ক, আপার ট্রাঙ্ক, মিডল ট্রাঙ্ক, লোয়ার ট্রাঙ্ক। Each of these trunks are going to split into 2, কি বলবো তাদের? ডিভিশনস, তাই তো? কি ডিভিশন বলবো? We are going to call them as anterior division and posterior divisions. Make divisions. A and P, A and P. So divisions are there. So how many divisions we are getting altogether? 6, right? So we have 6 divisions. Now what we are going to do with the 6 division? Again we are going to join them to make 3 again. Then we are going to call it as chords. So we have roots, then we have trunks, then we have divisions, then we are going to have chords. So this particular chords that we are going to make. So this posterior one unites all the 3 posterior divisions are going to unite together, going to make chord. We are going to call them as posterior chord. So that's the easy one. So this and this mixed together as posterior cord, P cord, easy for us. Then we are going to identify upper divisions of these upper cord, upper trunk and middle trunk. So they are going to be joined together to form another cord. We call them as lateral cord. So we get two cords, lateral cord and posterior cord. And then we are going to talk about, if you have lateral, then we are left with one only. We call them as medial cord, M. হয়েছে সবার এই পর্যন্ত? বেশ, we'll deal with these cords later. We'll deal with these particular branches which are coming from these roots or the divisions or these particular trunks, whatever is necessary for our upper extremity. This is not all the branches that what the brachial plexus is coming with, but we are referring to the branches, prime branches, which is for our interest, right? So from this particular region, C5, C6, C7, the roots, we have a bunch of nerve going down. So C5, C6 and C7 going down. It's a long nerve. We call them as long T thoracic nerve, LTN. Oi, huh? Wrong cord. Upper cord. Long thoracic nerve. Okay. Then we get this particular from here as a nerve as, from this point we have this particular DS, dorsal scapular nerve. Dorsal scapular, D for dorsal, scapular for the scapula, right? Now from these particular trunks we have one down and one up. The down one we call them as NS, nerve to subclavius. Subclavius is a muscle, we call them as nerve to subclavius. We call them as NS. Then we have a nerve which is going up. We call them as SSN, suprascapular nerve. So 1, 2, 3, 4. We number them. 1, 2, 3 and 4. হলো সবার? চারটে হয়েছে সবার? ঠিক আছে? বেশ। Then we are going to deal with the cords. So how many branches coming from each of these cords, that we have to remember. Then we can collect it back. From this lateral cord, how many branches we are going to see? 3. The main cord continues down as musculocutaneous nerve. We call them as musculocutaneous nerve. So MCN, musculocutaneous nerve. Then it is going to supply what? Pectoralis muscle. We call them as lateral pectoral nerve, LPN. And it gives a branch to form another nerve. We call them as median nerve. So median nerve is formed by this lateral cord and as well as medial cord, both of them together. So we call them as the branch which is coming from lateral cord, we call them as lateral root of median nerve. Median nerve, lateral root is coming from here. So we have 3 branches coming from here. Lateral pectoral nerve from the lateral cord, lateral bilateral, musculocutaneous nerve and lateral root of median nerve. সবার পরিষ্কার না পরিষ্কার হয়নি? ফলো করতে পারছো? We can follow. So we number it. 5, 6, 7. ঠিক আছে? Now the middle one, the medial cord. Medial cord এর কটা ব্রাঞ্চ? 5টা ব্রাঞ্চ। দুটো সেন্সরি, 3টে মোটর বা মিক্স। ওকে? সো প্রথমে যেটা বাকি থাকবে সেটা দিয়ে শুরু করছি।
কি বাকি থাকবে? আমাদের মিডিয়ান নার্ভটা বানাতে হবে, মিডিয়াল কর্ড থেকে একটা ব্রাঞ্চ দিতে হবে। ল্যাটারাল কর্ড অলরেডি দিয়ে দিয়েছে, সো উই হ্যাভ টু সেন্ড এ ব্রাঞ্চ টু lateral branch or lateral root of medial nerve. We call them as medial root of median nerve, and that makes a common nerve together. We call them as median nerve. So this is one. Sorry, this is something. We're going to number it later. Then we have this particular medial pectoral branch, just like lateral pectoral nerve, easy. So medial pectoral nerve. Follow? The main median nerve continues as ulnar nerve. So we have three motor branches, 1, 2 and 3. Then we are left with sensory branches. That means touch, pain, temperature. It is 2, 1 and 2. We call them as medial cutaneous nerve of arm, forearm. So নামটা ভাঙলেই বুঝতে পারবে, medial cutaneous nerve of arm. তার মানে কি? মিডিয়াল সাইডে থাকবে, কিউটিনিয়াস মানে স্কিনে যাবে, আর নার্ভ অফ আর্ম মানে আর্মে সাপ্লাই করবে, মিডিয়াল সাইডে স্কিন সাপ্লাই করবে। সিমিলার টু দ্যাট, মিডিয়াল কিউটিনিয়াস নার্ভ অফ ফোর আর্ম মানে ফোর আর্মের মিডিয়াল সাইডে যাবে। কোনটা মিডিয়াল সাইড? যেটা মিডিয়াল সাইডে থাকছে আমাদের টুয়ার্ডস দিস পার্টিকুলার বডি, এটা ল্যাটারাল সাইড অফ দ্য আর্ম, রাইট? সো দিস মিডিয়াল কিউটিনিয়াস, কিউটিনিয়াস মানে যখনই বলে দেবে তখন আমাদের বুঝতে হবে এটা সেন্সারি। তার মানে কি? টাচ, পেন, টেম্পারেচার এ ক্যারি করবে, এর কোনো মোটর সাপ্লাই নেই, কোনো মাসেলকে সাপ্লাই করছে না। বাকিগুলো হয় মাসেলকে সাপ্লাই করবে অথবা সেন্সারি সাপ্লাই থাকতে পারে, মিক্সড হতে পারে। কেমন? সো উই নাম্বার দিস 5 অফ দেম, 5 আইডেন্টিফাই করতে। কোথায় শেষ হয়েছিল নাম্বারিং? 7 এ, 7 এ। তার মানে 8 হলো এটা মিডিয়াল রুট অফ মিডিয়ান নার্ভ। দেন মিডিয়ান নার্ভ আমরা 9 করি, তারপরে মিডিয়াল পেক্টোরাল নার্ভ 10, তারপরে আলনার নার্ভ 11, কিউটেনিয়াসটা তাহলে কত হলো? 12 and 13. So we get 13. So 3 plus 5 and these two roots makes this particular median nerve. সেটা নাম্বার পেয়ে গেলাম। ঠিক আছে? হলো? ক্লিয়ার এভরিবডি? নার্ভের নাম বুঝতে কারোর অসুবিধা নেই? আছে কি নেই? এভরিবডি আন্ডারস্ট্যান্ডস দ্য নেম অফ দ্য নার্ভ? ওকে অর নট? হ্যাঁ না না? আবার ব্রেক নিবি, বাইরে থেকে হাওয়া খেয়ে আসবি, ঠিক আছে? তাহলে আরেকটা কাজ বাকি আছে, পস্টিরিয়র কর্ড। কটা ব্রাঞ্চ আছে? আবার সেই 5টা ব্রাঞ্চ আছে, ঠিক আছে? বেশ, 5টার মধ্যে এই আগে একটা বড়, মাঝে একটা ছোট, তারপর আবার বড়, এটা আগে করে নি আমরা। তাহলে এটাকে বলি আপার সাবস্ক্যাপুলার নার্ভ। তারপরে যেটা আছে ছোটটা সেটা হচ্ছে টিডি, থোরাকো ডরসাল। আর তারপরে যেটা আছে লোয়ার সাবস্ক্যাপুলার নার্ভ। 1 2 3 হয়ে গেল, ঠিক আছে? দেন the main trunk becomes radial, কি নার্ভ? রেডিয়াল নার্ভ। আর একটা ব্রাঞ্চ আছে AXN, অ্যাক্সিলারি নার্ভ। এবারে নাম্বারিং শুরু করে দিই। 14, 15, 16, 17, 18 till I die. এবারে কার নার্ভটা, কোন নার্ভটা বুঝতে অসুবিধা আছে? নার্ভের নাম বুঝতে কারোর অসুবিধা আছে? থাকলে বলে নে। অসুবিধা আছে? difficulties with the name of the nerves? Any of this, please address it, because you are not going to study at home. You study at here and finish it here. ওই খোকা, ঘুম ভেঙেছে তোর? এখনো ঘুম ভাঙেনি? ভেঙেছে? ভোর হলো, দৌড় খোলো, খোকা বাবু ওঠরে। সব নামগুলোর নাম মুখস্থ করেছিস? নামগুলো মনে হয়েছে? হ্যাঁ, হয়নি তো? হবে না তো? কি করতে হবে? 100 বার লিখতে হবে এই ছবিটা। ওকে, আরেকবার ড্রয়িং করবি নাকি? বলছে না, করে আরেক করে ফেল। কই গেলি? 1 2 3 4, 3 থেকে ওপরের দুটো জুড়বে, তলার দুটো জুড়বে, হবে ট্রাঙ্ক। আপার ট্রাঙ্ক, মিডল ট্রাঙ্ক, লোয়ার ট্রাঙ্ক। দুটো ডিভিশন, অ্যান্টিরিয়র পস্টিরিয়র। পস্টিরিয়র গুলো একসাথে, পস্টিরিয়র কর্ড। আর ওপরের দুটো অ্যান্টিরিয়র ডিভিশন যুক্ত হয়ে হবে ল্যাটারাল কর্ড। ল্যাটারাল কর্ড, পস্টিরিয়র কর্ড আগে পেয়ে গেলাম, যেটা বাকি থাকলো সেটা মিডিয়াল কর্ড হয়ে গেল। ল্যাটারাল কর্ডের 3টে ব্রাঞ্চ, বাকি দুটো কর্ডের 5টা করে ব্রাঞ্চ। আর সামনের দিকের কর্ডস আর রুটস এর মধ্যে, এই প্রথমে ডিভিশনের মধ্যে 4টে ডিভিশন। লং থোরাসিক নার্ভ, ডরসাল স্ক্যাপুলার নার্ভ, আপার সাবস্ক্যাপুলার, সুপ্রাস্ক্যাপুলার, আর হচ্ছে নার্ভ টু সাবক্লেভিয়াস। Okay, now we are going to place the name of the muscles that are supplied by them, right? So we identify the easy one first. Easy one we are going for. We take this 18 nerve, radial nerve. Okay, so radial nerve supplies all the muscles that is present in the back of our arm and back of forearm. So all muscles that are present in the back of arm and back of forearm. তার মানে এটা হচ্ছে flexor aspects, এটা হচ্ছে extensor aspects. So all the extensor muscles in the arm and the forearm. আগের দিন আমরা dissection করলাম back এর muscle, arm and forearm. So all the arm and forearm back muscles are supplied by one nerve only, radial nerve. সবথেকে সহজ মনে রাখো. So all the back is supplied by the radial nerve. It's a muscle. Radial nerve is a mixed nerve. It has a sensory supply. So all the back of this particular sensory supply also more or less is supplied by the radial nerve. So skin supply on the back side, muscle supply of the blood side. At your level, eyes closed, you can say it is supplied by branches of radial nerve. ঠিক আছে? Radial nerve প্রথম কোথায় দেখতে পেলাম? স্পাইরাল গ্রুভে। মনে আছে স্পাইরাল গ্রুভটা কাটলাম, ল্যাটারাল হেড, মিডিয়াল হেড, লং হেড, তার মাঝে পোস্টিরিয়র মিডিয়াল হেডটা কাটার পরে তারপরে বেরোলো সেই জায়গাটাকে বলি spinal groove, also known that particular space as lower triangular space. So radial nerve, all the muscles in the back is supplied by this. This is the easiest one. Second one, the musculocutaneous nerve. It is also musculocutaneous, that means it supplies muscle, and a cutaneous, that means sensory. It's a mixed kind of nerve. Sensory supply, motor supply is there. So this particular motor supply, it supplies this muscle, we call them as BBC. Biceps brachii, brachialis and coracobrachialis. All the muscles that is present in the front of our arm that we have done the dissection, biceps, coracobrachialis, brachialis, তিনটে muscle. সেই তিনটে muscle supply করে এই musculocutaneous nerve. Clear? So these two are easy to figure out. Now number 3, we are going to talk another easy. This long thoracic nerve. So it's a long nerve which supplies over here. It supplies this particular muscle. We call them as latissimus dorsi. In short, we call them as lat D. Taito. So it supplies the muscle in the back region. Lat. So latissimus dorsi supplied by the long thoracic nerve. ঠিক বললাম? বেশ, ঠিক বলেছি। So it is supplied by latissimus dorsi is a muscle which is supplies a muscle. We call them as serratus anterior. So the serratus anterior is a muscle which is helping us to push and punch. So this particular latissimus dorsi is the nerve which supplies this particular muscle, which is present in deep side on the medial side. We call them as LAT, this serratus anterior supplied by this nerve. We call them as long thoracic nerve. We call them as a long thoracic nerve because as we see the dissection on this region, this particular nerve is visible. So that's why we know this particular name of the muscle as a long thoracic nerve, and supplies the muscle as serratus anterior muscle. It supplies like in divisions like this. Small branch দিয়ে serratus anterior কে supply করে। serratus anterior টাকে serratus বলে কেন? muscle টাকে এরকম দেখায়, that serrated দেখায়. That's why we call them as serratus. It has 8 peak or sleeves like this. So coming from this long thoracic nerve, we have this particular other muscle which is known as lat, which is supplied by lat D, is supplied by this thoracodorsal nerve, TD. So this thoracodorsal nerve supplies a muscle, we call them as latissimus dorsi. So this is another muscle that you have to just reflect over here. Now this suprascapular nerve, SSN, supplies the muscle which is known as supraspinatus, infraspinatus. So this muscle above the spine, below the spine, by the supraspinatus, SSN, suprascapular nerve, supplies this particular supraspinatus and infraspinatus. Now this dorsal scapular nerve, which is present on the back side, we call them as dorsal scapular back side. It supplies the muscle, we call them as rhomboid. Rhomboid major, rhomboid minor, that small muscle related to the back of the scapula, along with the levator scapulae, is supplied by this dorsal scapular nerve. So this dorsal scapula supplies to it. Now to subclavius, it supplies a tiny insignificant muscle, we call them as subclavius muscle, that supplies to this particular region. So this is about the muscle supply which is related to this particular region. Now moving to this particular another thing, which is the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. They do not supply any muscle, they are cutaneous branch. That means they supply the skin. Medial side of the arm, medial side of the forearm. That supplies this particular region by the cutaneous nerve. Now coming to this particular pectoral muscle. Our pectoralis major and pectoralis minor. We have lateral pectoral nerve, we have medial pectoral nerve. So the lateral pectoral nerve principally supplies this pectoralis major, and this medial pectoralis nerve supplies principally this pectoralis minor. So this is, we have to memorize in that particular way. So pectoralis, lateral pectoral nerve, is supplying this particular pectoralis major and pectoralis minor. But having said that, this particular pectoralis muscle, lateral pectoral and the medial pectoral, has a variance. That means it may supplied by the both of them, or maybe just like one of them are supplied by two. So this particular pectoralis muscle, major and minor, supplied by this particular pectoral nerves, medial and the lateral. If you just say it common together, it's not going to be a mistake. So pectoralis muscles, pectoralis major, pectoralis minor, if you say are supplied by these pectoral nerves, that is okay and fine over here in this whenever you are going to talk about. But this particular nerves is highly variable, lateral pectoral and medial pectoral. Lateral pectoral is the one which is supplying the pectoralis major, piercing through it. Once it pierces this pectoralis minor, it might supplying that particular muscle as well. Now talking about this particular nerve which is known as median nerve. So it's a kind of principal nerve that you have to address here is median nerve. So median nerve is supplying muscles in the arm, and it supplies the muscle in the forearm. Sorry, it do not supply muscle in the forearm, it supply muscle in the forearm, and it supply muscle in the palm or hand. In the forearm, it supplies all the front muscle. That means all the muscle in the front side over here is supplied by this particular median nerve, all except 1.5 muscle. So front of the forearm, also known as flexure of the forearm, it's supplied by this median nerve, all except 1.5. So 1.5 we'll address later. In the palm, it supplies principally the thinner muscle. This is one group, and another muscle we call them as lumbricals. Lumbricals. Lumbricals, one plus another. We call them as 1 plus n or 2. Lumbricals 1 and lumbricals 2. So these are the things that you have to keep in mind regard to the muscular supply of median nerve. Now median nerve, likewise other nerve, is also a nerve which is a mixed kind of nerve. So it is a sensory nerve, it's a motor nerve. We are just referring to the motor part, sensory part we'll talk later on. So median nerve is another nerve which supplies the front of the forearm, all except 1.5 muscle. 1.5 muscle we'll talk later on. And this palm, it supplies a group of muscle, we call them as thinner group muscle, which is below this thumb. And lumbricals 1 and 2. So this much is good for us for now. As we progress later on, we are going to talk about. Now another easy one is axillary nerve, AXN. It supplies the deltoid muscle, which is very common and very popular. And then we have another muscle related to the deltoid. Under to it, we have this teres major and teres minor. So this teres minor is supplied by this axillary nerve. So these are the few things that you have to keep in mind regard to the muscle supply of these regions. Now coming to this particular ulnar nerve. So this ulnar nerve is contemporary with this median nerve. So median nerve and ulnar nerve, both of them supplies the front of the forearm and as well as palm. So this ulnar nerve, it supplies muscle in the forearm and it supplies the muscle in the palm. So in the palm, it supplies a group of muscle, we call them as interossei. I-N-T-E-R-O-S-S-I, interossei muscle. And interossei muscle has got two groups. We have this dorsal group and ventral group of interossei. Now you have the muscle, we call them as interossei. It supplies a muscle, we call them as lumbricals. Number 3 and number 4. And it supplies a muscle, we call them as hypothenar group of muscle. So these are 3 group of muscle in the palm: hypothenar, lumbricals 3, 4, and interossei. In short, all of interossei, all, if you just say all interossei, that covers this particular all interossei supply over the palm in the thenar muscle. Now in the forearm, it supplies only 1.5 muscle. What 1.5 muscle? this 1.5 muscle, which this particular one, which is this one is not supplied. So this forearm, everything in the forearm is supplied by the median nerve except this particular 1.5. What this 1.5? We call this 1.5 muscle is that flexor carpi ulnaris and flexor digitorum profundus ulnar half. So flexor digitorum profundus is a muscle. If you see, this muscle has got two parts split by this supply. One half is supplied by the median nerve, other half is supplied by this ulnar nerve. So we call them as half of this flexor digitorum profundus and flexor carpi ulnaris, all of it, that makes this 1.5 is supplied by this particular ulnar nerve. So these divisions of this muscle supply is important to us, that we have to remember so far. We have to remember this particular radial nerve. You have to remember this nerve supply of this ulnar nerve. You have to remember the nerve supply of the median nerve. So remember this, median nerve and ulnar nerve do not supply any muscle in the arm. They supply in the forearm and beyond. So this median nerve and the ulnar nerve, they supply in the forearm and the hand. Whereas this radial nerve, they supply this particular arm, backside, forearm, and as well as it supplies the cutaneous supply on the backside of the hand. So these particular divisions of this muscle supply, ulnar nerve, median nerve and this radial nerve is important to us. Besides that, we have to know about this musculocutaneous nerve. We have to know about this particular axillary nerve for sure. So these 5 nerves you must come prepared with. Then we have to talk about this thoracodorsal and this long thoracic nerve. These 5 are very important, 6 very important nerve supply to these particular regions of this muscle supply. So what you have to do over here is we have to draw this particular brachial plexus divisions and this particular complex network of these nerves, how these particular muscles are formed. And then from this region we have to know the names of the nerves. Once you know the names of the nerves, we have to know the nerve supplying muscles, what are the supply of this particular muscle are coming from. Like all of them are not possible at that particular point, but we emphasize on this particular region like radial nerve, ulnar nerve, musculocutaneous nerve, all these prime things which I have mentioned and put a star on this. Upper subscapular, lower scapular is the supply the subscapularis muscle. Upper subscapular supply this subscapularis upper part, and lower one is supplying the lower part of the subscapularis. Along with we are living with this teres major is supplied with it. So if you can remember anything beyond this particular stars which is put on, then we will talk about this upper subscapular, lower subscapular, or this particular dorsal scapular, or all these things. So whatever the stars I put them on regard to the nerve supply to the muscle, that you prepare on regard to this particular region. Now this medial cutaneous nerve of arm and forearm, this is an important sensory muscle that we have to know. Now why this particular thing is sensory important to us? Because it supplies the medial side of the cutaneous supply of the arm and forearm. Now how this particular thing becomes important to us? This particular nerve carries pain sensation from the thorax region or from the thoracic cage. So this is a kind of important for us. When you are going to talk about the thorax in the chest wall and chest wall nerves, we'll talk about this medial cutaneous nerve of arm and the forearm, the clinical significance part, once we learn the chest and the heart sector. Before that, we just know that the medial cutaneous nerve of arm and forearm is important clinically. We'll explain why it is important clinically when you're going to talk about the hearts and everything. So, to summarize the thing that we are putting emphasis on, we are going to draw this particular picture and these branches of the nerves. That is the one thing. All these 18 branches we should remember them. And once you know these particular branches, we should be emphasizing on nerves which are supplying to it, like the nerve supply or nerve supplying the muscles. We'll have to know this musculocutaneous nerve which is supplying here the muscle. We have to know this axillary nerve, what does it supply. We have to know this ulnar nerve, we have to know this median nerve, we have to know this radial nerve. Out of the branches which is coming from this root, we have to must know this particular long nerve, long thoracic nerve, what does it supply, and thoracodorsal nerve, that what supplies to it. Then afterwards, later on, we'll go and talk about this particular cutaneous divisions of this medial cutaneous nerve of arm, forearm, and then subsequently smaller branches. So this median nerve, as I have brought it down, median nerve supplies the arm, do not supply in the arm, it supplies this particular muscles of the forearm and the palm. So in the palm region and in the forearm region, predominantly we see this median nerve and the ulnar nerve supplies. So all the muscles in the forearm and in the palm region are supplied by this either ulnar nerve or by this median nerve. So median nerve predominantly supplies the muscle of the front of the forearm, whereas this ulnar nerve predominantly supplies all the muscle present or majority of the muscle present in this particular ulnar nerve. So all these smaller muscles which are present in the palm helps us to do the delicate jobs. That means we are holding the pen, we are just like a painting or doing this precise movement of the fingers. So that needs a very intrigued nerve supply to the muscle which are present in it. So that's why this particular ulnar nerve, we call this nerve as musician's nerve. It is the nerve which is doing or helping us to do the sophisticated, delicate functions. So this ulnar nerve, we call them as musician's nerve. And the median nerve, as we are seeing here, it supplies the muscle majority in the forearm, which is the power muscle. That's why this median nerve, we call them as labor's nerve. So musician's nerve, because of the delicate fine works which is done by these fingers, holding the violin, piano, guitar, pen, pencil, precise movement, doing some kind of delicate fine works, all these tidbits, smaller things is governed by this particular nerve supply coming from this ulnar nerve. That's why we call them as precise nerve, also known as the musician's nerve, which needs a very delicate finger movement. And the muscle action which is done by this labor, hammering, pulling up things, all these things are done by this particular, the nerves which is muscles which are supplied by the median nerve. That's why the median nerve is known as laborer's nerve. Laborer are weightlifters kind of nerves. So these are the two divisions. And everything on the back side, whatever the muscle you see that, all the back of the forearm or the back of the arm, whatever the muscles are visible there, all the extensor muscles, they are by the radial nerve. That's eyes closed, that's the easy thing. So this is how we are going to talk about. So over here is musculocutaneous, front side, back side, radial. Here in the forearm, majority is median, 1.5 is ulnar. Back side, same thing, radial, all of it. Palm, majority is ulnar and only in this region where you have 3 muscles and lumbricals 1 and 2, which is 5 together plus 1 is another there. So these particular few muscles are by this median nerve and rest is interossei, lumbricals and all these delicate finer movements, lumbricals, everything is by this ulnar nerve. So these divisions that you have to keep in mind, MCN, radial, median, ulnar, radial, median and ulnar. Backside in this region, we have no muscle supplied by this radial nerve. Here the skin only on the back side of this back of the arm is supplied by the radial nerve. So radial nerve supplies all the muscle in the back of arm, forearm. In the palm or hand region, radial nerve have no motor supply, only cutaneous skin supply. Alright. So this is the complex thing. So you just like digest this particular thing about drawing here, then you take this particular, put the star mark on nerves which are supplying to this particular muscle. MCN is a must know, radial nerve, ulnar nerve and median nerve are must know, and axillary nerve, of course, this is a deltoid and this particular teres minor which supplies here. and musculocutaneous, the medial cutaneous and the arm and forearm are important, but the significance or the clinical role we learn in thorax. And then we have this long thoracic nerve and this latissimus dorsi, which is supplied thoracodorsal nerve. We are going to talk and learn about these particular elements. So you have a huge task to cover this weekend. So draw this, make sure you draw each and every one. So this particular drawing and narrating and describing it is a full marks 15 question, what you have done here. Then the clinical questions will be following on. So that's it. Thank you.